Hi, I'm Dr. Erika Bruner, and today I'm going to talk about cognitive dysfunction syndrome, which is what we call it in the veterinary community. I've heard lay people refer to it as doggy Alzheimer's, although cats can have it as well, certainly. And what it represents is that our older animal is basically is experiencing some level of dementia. And this can be very challenging as a caretaker of an older pet to deal with because it quite often impacts not only your pet but also your life. I think it's helpful to recognize this early, to start nutritional supplement especially, to try to prevent the onset of canine cognitive dysfunction syndrome or feline cognitive dysfunction syndrome. Not every older pet is going to go through this, although it does seem pretty common. Sometimes it's pretty benign and not too difficult to deal with, and other times it's very, very challenging, especially when it results in disturbed sleep at night, because then of course everybody's sleep is disturbed. So there are some helpful nutritional supplements. There are also some medications that can be useful, but the earlier we start with these things, the better success we're going to have. And I'm not going to recommend anything specific in this video because I really think that it's important to check with your vet specifically. And then also because things are always changing, and so there might be some new thing that gets introduced 2 weeks from now that is the greatest stuff on earth. And so getting a current recommendation from your own vet is the best way to go. So early signs of cognitive dysfunction syndrome can be, not relating to people in the household in the same way. Maybe your dog seems more withdrawn, doesn't seem to want to do the things that they normally did, or doesn't seem to be relating to you in a way that, I think they actually sometimes can stop recognizing us or not quite know who we are, and that can change the way they respond to us. With my own cat, when she was about 21 or so, she stopped recognizing my hand. I had thought she had some vision deficits because one of the things we would do together is, she would be walking through the room and I would put my hand down to her and she would come over and smell my hand, and then I would pet her. And she started to just walk by the hand, like just a couple of inches away from it, but walking by it like she didn't see it. And I tested her vision. Chiefly the way I did that was to use some cotton balls and to throw those kind of just at the edge of her field of vision and to see if she could see them, because they don't make a sound when they land. It can be a good vision test. And she could see, but I came to realize that she didn't recognize my hand for what it was. It had lost its meaning for her. So not relating to people in the same way. Quite often people will tell me that their dog goes to the wrong side of the door. They maybe go to the hinge side of the door instead of the handle side when they want to go out. Or sometimes they ask to go out and then kind of wander around out there looking like they don't really know why they wanted to go out, and then they come back in and then they want to go out again. I mean, this can be normal behavior, especially for cats, but there's a level of kind of apparent confusion that's going on that you can pick up sometimes, that they don't quite know what's going on. Anxiety at night, sometimes people will say when they come home in the evening, their dog seems agitated and is pacing around, or their cat, especially in the middle of the night, yowling cats. That's a not uncommon thing to see as cats get older. And the yowling midnight cat can be related to pain, can be related to hyperthyroidism, can also be related to dementia, and then sometimes has no obvious cause, and probably a lot of those ones are sort of in the dementia realm. But they're not necessarily fully losing their consciousness about everything in all departments at the same time. So they might seem pretty normal during the day, but then go around meowing randomly at night. Or one of my dog patients, the folks reported that he would get them up in the middle of the night as though he had to go pee. Like every night at 2 or 3 o'clock in the morning, he would urgently want to go out. And then they would let him out and he would be like, it's a lovely night. What a beautiful moon. And they're like, why are you not peeing? You got us up. Don't you have to go? Isn't it urgent? Like, this was not something he had ever done before in his life. But what it represented was a level of confusion. Sometimes people will say, you know, the dog seems like he's lost in the dining room. Like we're in the living room and he's in the dining room barking because he can't find us and he doesn't know to walk out to the living room and find us there. I do think a lot of the signs are, people are quicker to pick them up in dogs because I think, you know, probably because dogs have lived with us for so long, for like 50,000 years, right? That their way of being and their way of expressing themselves and our way of understanding that, you know, it's maybe more obvious. Whereas cats often have behaviors that we don't fully understand. Like, why do you stare out the window for 10 minutes at what I can't see anything out there? And then suddenly you get some massive idea and like pew, you rush off to go do something else. Like, what is that? You know, so their motivations aren't always as clear to us as dogs' motivations are. Their facial expressions, you know, dogs have those beautiful expressive eyebrows. Cats have a much more kind of serene or placid face. You know, they're expressive with their ears, but maybe not so much with their eyes. For whatever reason, it does seem harder to recognize dementia in cats. But one of the signs I often hear about is somebody asking for food and then not really eating what they're given and then seeming to be asking for food again. You know, I've got a patient right now who's 19 years old and her owner is really frustrated because she's just constantly asking for food, and yet there it is, like he just gave her some. What does she want? And I have heard that kind of thing from a lot of other folks. I think that represents dementia. You know, so unfortunately, while there are these nutritional supplements that maybe could help prevent or slow down the progress of dementia, there's some thought now in humans that diet can play a role. We might see the same thing be helpful in pets. And then there are medications. You know, if anxiety is a big component of somebody's dementia, anti-anxiety medications can be really helpful. If nighttime wakefulness is a big part of it, sometimes it's very helpful to give a mild sedative before bedtime, or pain medication. Pain can be worse at night, and that can be a reason to be restless. So making sure we've done everything we can to relieve pain is important. And I do find that acupuncture helps with this also. So, you know, I guess the last thing I have to say is just that it's really hard. People don't always recognize, for ourselves even, how hard it can be to be the caretaker of an elderly pet. It can be a whole lot like being a caretaker of an elderly human, and yet you are often alone in this, or maybe there's one or two other members of the household that are helping you, but the burden really does fall heavily upon us, you know, the pet people, the guardians, owners, whatever you want to call it. And that is hard. It's not easy. And it's also hard to make sure, you know, to try to do the best we can to make sure that they're happy and comfortable. And this is part of what goes on with older pets that makes us worry that they're not happy and comfortable. So I urge you to talk with your veterinarian and see what could be helpful for your pet. If you'd like to know more about my work as an acupuncturist and end-of-life care veterinarian, just check out my website, heartofvermontvet.com. And if you would like to set up a consultation with me, or you have a question for the series of frequently asked questions, or a suggestion for a topic, please send me an email, info@heartofvermontvet.com. Thanks.